Kardashian. She's the picture-perfect reality star, right? But now she's sharing a new reality, talking about her battle with psoriasis. The 38-year-old selfie queen took to Instagram showing this picture of patches on her face. You see there, forehead, her chin. The mom of three says those dark smears you see, that's the herbal ointment she's using to treat the flare-ups from this skin condition. So what's she dealing with? Let's bring in Dr. Michelle Henry, dermatologist out of New York. Give us that definition. Psoriasis, what's Kim Kardashian up against here?
So psoriasis, and I really applaud her bravery for sharing her story. Psoriasis is the most common autoimmune condition in America. It affects about 8 million Americans and about 2 to 3% of the population worldwide. So what happens is the immune system starts to attack healthy skin cells, and they respond by overproduction. And so what you see are thick, scaly, red, irritated plaques. They can affect the entire body, they can affect the face, and as you can imagine, it can be quite crippling because of the stigma of skin lesions.
Gotcha. Okay, so when you say autoimmune, body's attacking the cell, so there's flare-ups. Is there something you do that causes a flare-up? Maybe you eat bad, maybe there's stress, lack of sleep. What can key that?
You really hit the nail on the head. So stress plays a huge role in flaring psoriasis. Illnesses can flare psoriasis, and actually a lot of common medications. So lithium can flare psoriasis, as can ACE inhibitors, another type of a common hypertension or medication for your blood pressure. So there are many triggers, and oftentimes it's difficult to find the exact trigger for the particular patient.
Got it. So, and again, Kim Kardashian is sharing her remedy here. It sounds like an herbal ointment. Is that the way to go, or what else can you do to treat it?
So we're really lucky that we have many types of medications and treatments. So there are topical treatments, many of which are herbal or more natural. So one that's really popular is coal tar. And her ointment is quite dark, so I imagine that it may have some elements of coal tar. In my office, we use topical corticosteroids, which are really popular. There are light treatments. So actually sunlight helps with psoriasis somewhat. And there are also more advanced oral and even injectable treatments for psoriasis.
Got it. Not curable, though. Again,
not curable. It's genetic. We inherit it from our parents, so something to blame our parents for. Or there are also environmental triggers. Not curable, but we have some really great medications which can help with the symptoms and calm the overall systemic effects of psoriasis.
Got it. And you kind of touched on it at the beginning. How important is it, or how impactful is it when someone with a name like Kim Kardashian is vulnerable enough, shares this? Does it help someone, who's not the big-time star who's dealing with this?
It is very impactful. Again, she is now a champion for the 8 million Americans and 125 million patients that suffer with psoriasis nationwide or worldwide. There's a lot of stigma. These patients are in hiding. I have patients that have lost job opportunities, they won't seek intimate relationships because of psoriasis. And education is really the key to reducing that stigma. So what she's doing is huge and very impactful.
Wow. Okay. Well, Doctor, thanks again. Dr. Michelle Henry, dermatologist out of New York. Appreciate your insights on this as Kim Kardashian shining a light on psoriasis for us.
Thank you for having me.